Hi, everybody. It's so good to be with you again today. I'd like to welcome Dr. Amal Tokars, who is the Executive Director at the Kendall County Department of Health. Dr. Tokars has been with the Department of Health now for since 2005, and she's been such a great partner for us through a few issues over the last year, but most importantly, this coronavirus pandemic. She, like other health department officials, are on the front lines of helping to keep our communities safe and healthy. And so we're so grateful and honored that she's joined us for a conversation this afternoon. She's going to answer some questions that we're hearing from everybody that they've been calling our office or emailing us with. And so we're so thrilled to hear from an expert directly today and know that she has a lot going on. So we're going to keep it brief. So Dr. Tokars, welcome. And if you would, to start, just introduce yourself and give us a quick update on what's going on and what the Kendall County Department of Health has been doing in order to respond to the coronavirus pandemic.
Okay, I'm going to put my glasses on because I wrote a couple of notes, but my name is Amal, and I'm with the Kendall County Health Department. And I want to say that I'm grateful that you've invited us to speak with you. I'm grateful for my staff and a lot of cooperation from community partners that are working really hard. Very early on in the beginning of February, when this really started to come to our attention, we began by learning about the data and gathering that data and speaking about it to others to help one another prepare. We also began screening very early in February. That began people calling us who needed screening and really advocating for them as the instruction that we were receiving evolving, to try to give them clear instruction as that evolves, and it continues to evolve. So try to help each person one at a time, as well as putting messages out that would keep people safe. Working with our local partners, from the ones that you would think would be more obvious from our school systems and police and EMS and local leaders, but our faith leadership, our everyday persons in the community, every single person, we are really in each other's hands in terms of keeping each other safe on this. And then working closely with our state partnership and thinking about all the essential ways that we can keep ourselves safe, since there's not medication for this at this time. So those are some of the things that we have been doing and will be continuing to do, even though that is evolving and ramping up very, very quickly, as you know.
And if you can just let our community members, our neighbors know, literally, what do you all do? So, we know that there are cases in the 14th district. We know that there are cases in the communities that we live in. And so can you talk about your role in interacting with families or individuals who may be sick?
Yes. So in addition to the things that I've mentioned to you, if we receive, and we have received, notification from the state of Illinois that one of our local community members has tested positive, then what we are doing is promptly getting in touch with that person and that family and letting them know, hearing about the space in their home, because we're going to work with them on a self-isolation that is really customized to their home. And that's a whole family wanting to be in self-isolation, but wanting to have a separation from the sick person to the individuals that are not sick, so that it won't be spreading throughout the house. And so we want to settle that right away. And then thinking about if another relative is going to go grocery shopping for them, bringing them food, what is a safe way to drop that off? And that really is essentially scheduling the time approximately that the food would be dropped off, putting it on their front doorstep, and then going back to your car and calling them and making sure that they know that's there. We don't want the raccoons getting to it. We don't want it being rained upon.
Yeah.
The same thing that you would do if you were ordering food from a restaurant. It's the same safe way that you can receive help and food assistance. So we want people to be comfortable. And the beautiful thing for those families now is we are all really in a little bit of that self-isolation, as we are all of us trying to, as much as possible, stay in place in our homes. So then we are in touch with them, and nurses in touch with them every single day to check on them with their symptoms, but also wanting them to keep their primary care physician, because we're not physicians, we are public health people. We want them to really keep their primary care physician in the loop of how they're doing, in case that primary care physician has other instruction of wanting them to go to the hospital to get oxygen, to get a CT scan, to get hydration, any of those things. So we want to be in touch with them, but we also want them to be in touch with their primary care physician. And we will stay in touch with them, not just for that 14 days, because really that's the incubation period. We want to be in touch with them until they are no longer contagious and their self-isolation is ended. So that will either end by them getting tested with a negative test, or by their primary care physician releasing them from that. And we will have to see, as tests are available, the way that that is going to work for us. But those are some of the things that we are doing with the patients right now.
That's fantastic. And we know in the 7 counties that we serve in the 14th district, that means there's 7 departments of health, and they do all of those tasks and more, including contact tracing. So for someone who is confirmed positive, being in touch with the people that they've been in touch with, involved in surveillance and some of the tracing of the illness in the community, and being involved in the testing and the test sites too, depending on per county. So Kendall County might not have the local test sites, but some others, the health department is involved. And so we have people reviewing throughout our community. So just so that they know the role of their health department in these activities.
Yes. And you know what, so I should have said, because testing is on everybody's mind. If we are screening somebody, and the screening and the testing in the lab, those are 3 different processes. So all the local health departments are screening individuals and looking to see if they meet that criteria to be testing. If we think that they meet that criteria, then we are calling and asking permission. The state is following the CDC guidelines. And if we cannot get a yes, if let's just say first we do get a yes on that, then they are going almost by appointment to the hospital for that test, and they will be received there by the hospital for that test. If they get a no, then we are really looking to see if there are any other possibilities for them. And sometimes their primary care physician may know of some other possibilities. But if they are getting yes, they are going to the hospital, and then the hospital is sending that to lab. That has to get processed at the lab, and then we learn about that positive, and then we're contacting that person as soon as we know about that.
Which makes the health department such a critical part of our local healthcare system, being in touch with the providers, being in touch with the State Department of Health. And then the other thing that we know that so many of our local health departments have been doing is finding those community resources in case we need extra bed space or treatment facilities or isolation facilities. And so in Kendall County is unique in our district in that Kendall County doesn't have a hospital. But for those counties that do have those health systems on site, then they also are doing this important work. So your job is big, ma'am. And we're so grateful for your time this afternoon to be able to share a little bit about your work.
Yes, so we are having some discussions about the possibilities of those things as well. But that is also depending on partners being able to bring those resources in. But we want to know about them either way so that we can send our citizens to the places those resources are at.
That's right. So when we think about all the things that might be on the minds of families in our community, what is the most important thing that they can do to support your work and to help keep our community safe in this time?
So if let's talk about a sick person, because that's what people are concerned about. Then let's talk about the rest of us who are well.
Okay.
So for sick, if someone is sick, first of all, they should stay home. But they want to call ahead to their primary care and really let them know. And you do not have to wait to feel, I think I have coronavirus. If you're sick, you can just let your primary care physician know and keep them apprised of it so that they will be more poised to help you without a barrage of all kinds of information. So you're giving it to them gradually and keeping in touch with your primary care in the very beginning. Your primary care physician has, as I mentioned earlier, has the ability to order tests that they might think that you should have proactively. Don't want to wait till you're flat on your back. They may order a CT scan. They may order hydration. They may want you to have certain things. They may order an influenza panel for you. So we want you to be in touch with your primary care physician so that you can get that help early and not wait for it to feel like an emergency. Then the health department or a hospital will do screening, and your primary care physician may send you either to the local health department or hospital for screening. If you need testing at this time in Kendall County, people are being sent to their local hospital either by ourselves or by their primary care physician. If someone becomes sick, it is wise, even if you haven't had a test, even if you think for sure you know what you have but don't know for sure, it's wise to just try to self-isolate. Definitely do not go to work. Definitely do not get on the train, okay? Do not do those things. No matter what you have, when you are sick, you just stay home. And it's wise always, but especially at this time, to self-isolate from your loved ones so that this is not being spread between one another. It's good for not only your family, but every single one of us to self-monitor every single day. When I get up in the morning, take a deep breath. Do I feel a tightness of breath? Do I feel a sore throat? Am I sick? We know if we're sick or well. We know our bodies. So every morning and every night, it's good for all of us to just do those general things for self-monitoring. Eat healthy. Sometimes when we hunker down, we want to have a lot of snacks and a lot of junk food. Try to really eat healthy. Fluid is medicine, water is medicine, sleep is medicine. So get plenty of sleep and do not feel guilty if you'd like to take a nap. That is just wonderful, wonderful for us to do. So those are the things that we should be doing, whether we are sick, talked a little bit about the sick person, and for the rest of us are well. Do help your neighbors. Don't be afraid to help your neighbor. We just talked about how to deliver things safely. You can talk with people on the phone. You can do these kinds of forums that we're having. You can do with one another and FaceTime and Skype in many different ways. And we can get things to our neighbors. We can say, I'm running to the store. Can I pick up something for you? So don't hoard, don't shop for the neighborhood, don't shop for all the relatives or people won't understand what you're doing, but you can shop for another person and pick up a couple of things for them. Do be aware that stores are having limits and they have limited store hours as well.
Excellent. And so you touched on it, but if someone in your home becomes sick, we want to have a household plan, right? And people can work with you to develop that plan, even if that person doesn't have a confirmed test that they're sick, right? Because we know that there is limited testing capacity, but if they need help with those plans, you all can be a resource.
That's right. So we are really talking to them about their particular house, and they can absolutely call us even if they haven't been tested and they want to know how to self-isolate. We're going to be asking about can the sick person use their own bathroom, even if it's a half bath? Can they use their own bathroom? Can they sleep in their own bedroom? Can someone prepare the meals for them? That person should not be the one preparing meals. And can someone serve them liquid all day long and prompt them by cell phone saying, did you finish that cup of tea on your nightstand? Did you finish that glass of water? Because we all know that when we are so sick, just the basic things, monitoring our temperature, are really hard to do. So we're going to want family members to prompt them to do those things so they can do themselves as well, so the family members are standing far away from them. Now, I also want to mention, Congresswoman, that we might assume that every home in Kendall County is a single family home. But let's just say that we have 5 people in a small apartment. And we have precious persons in Kendall County that live in apartments. And if they only have one bathroom and there's a family member that's quite sick, we want them to start thinking about, can the people that are well go to another relative's house? Okay. Or is it, what can we do? And people, we want to think about that ahead of time. If somebody was sick in our family, where would one of us stay home with them? Okay. And sleep on the couch and take turns using the bathroom and re-sanitizing, and the other family members go to a grandparent's or someone else. Every single one of us want to think about that, because we may be challenged by our space, and we may not have the luxury of multiple bedrooms and multiple bathrooms. And we want every single family to be thinking about that ahead of time. If I had to ask someone to go to the store and get me some toilet paper, I probably shouldn't be mentioning toilet paper first, since there's been a run on toilet paper, but we know people worry about that. Just some fruit and vegetables and some fish to eat. If we were really running low and we knew we could trust somebody to drop that off at our front doorstep, who would that be? We can be agreeing upon those things ahead of time and calling loved ones ahead of time. And we should all have a little extra food. We shouldn't hoard, but we should all have a little extra and know who's going to help us if we can't get out.
Awesome. So we've been hearing a little bit in the national news about treatments. And so just wondering if you might want to talk about any treatments for the virus.
Okay, very good. So right now there's not medicine that you and I have access to. But there is medical help that we have access to. I've mentioned a couple of those. So 3 really important things that a physician may be concerned about as a person needing to be hydrated. So first, we're hydrating ourselves with water and thin teas and maybe even soups in our home. Those are ways to hydrate ourselves. If we become dehydrated because we felt so sick that we forgot to drink and we didn't have somebody to prompt us to do that, or we are throwing up, that is not something that happens with everybody, but that can be brought on by fever. So if someone becomes dehydrated, a physician might want someone to go to the hospital to get hydrated. That is very critical medical help that can be life-saving if and when people need that. Second thing is oxygen. This does not happen to most people, but it will happen to people that, as this makes an attack on the lower respiratory and the virus is multiplying there, that some people will be having difficulty breathing. They should immediately contact their primary care or hospital for that, and they may need to go to the hospital for respiratory help. And that is, again, a life-saving. People should not wait till last minute. As soon as somebody is having difficulty breathing, they should be calling their primary care right away, and their primary care will give them instruction. They should not wait and say, let's see how it feels the next day. That is something that they should call right away. Third thing is temperature control. And that's something that most of us do at home, but it's really important that people are monitoring their temperature and controlling their temperature. And if they're having a hard time controlling their temperature, again, they should be in touch with their primary care, explaining to them what their temperature has been all day, what the trends on it are, and so that can be under control. Now, there are 2 things that we are hearing about in the news that are hopeful. They are not available to you and I now, but we hope for these to be available in the future. The first is antivirals that are specifically being developed for coronavirus. The contents of those antivirals that people are hearing about are not things they should be ordering and mail order and ingesting. Those are not intended to take over the counter. These are intended to be developed properly as safe antivirals for us to have when they are available to us, which is not yet. We know that these are being used in testing on the East Coast and in other countries, and we hope to hear more inspirational information about those soon. And we hope those will be ready for us, but they are not ready for you and I at this time.
And they
And the
definitely
next,
are not prophylactic, right? So they don't prevent it.
that's right. This
Yeah.
this is definitely to be taken for the sick person only in the way that it was prescribed in the formula. And again, I want to emphasize in the formula that has been prescribed. So the prophylactic people ordering ingredients of this and ingesting this can be not helpful and can be dangerous, is not to be done. Okay. The same with vaccination. We know that vaccination is under development, and we are hopeful to hear about this, but it is not online now. And we hope to hear more about that, but that is not what we have now. You and I are not, cannot be avowed about this, but we hope to see this in the future. So those are the 5 things right now: hydration, oxygen, and temperature control. Okay, these are all ways to help, but then down the road, antivirals and vaccination as well.
Perfect. And so as we wrap up, how long do we think that this virus could last, that we could all be at home? Do you have any kind of information to share with the community? Because it's been about 10 days that, we've been at this high alert. It's been about a week that so many of our kids have been home from school. Just wondering if you might want to speak on that.
You know what? The truthful thing for me to say, so that I'm not being cavalier, is I do not know. We do not know. What I do know, in looking at the epidemiological curve on this, which is very different from China's, our curve is very steep. And so when we have a curve that starts slow, doesn't get steep, and ends slow, let's say that we can fit 100 dots.
Mm-hmm.
Let's just say that we can fit 100,000 dots, and each of those dots is a person in that curve that starts slow, doesn't get steep, and ends slow. Those 100,000 dots of precious persons are more likely to be able to get quick and full response and access to what they want in our healthcare system. Let's say that the curve starts out slow, escalates very quickly in an almost straight line, which is what ours is now.
Yep.
And we don't know when it's going to come down. And let's say that there's still 100,000 dots only in that curve. Those same 100,000 precious persons are entering a time where our healthcare system is being challenged because of the steepness of that curve.
That's right.
That is the curve that the United States is in right now. We do not know when the curve is going to come down, but what we do know is everything that we are talking about in terms of social distancing and staying home, staying off public transit is really going to make a big difference. We know that that will slow that rate, bring that curve to start to level off. And when we say flatten the curve, we really mean the curve coming down, taking a nosedive, and flattening up down here. When we start to see a leveling off up here, that's wonderful. That's where China's at. We want to see the nosedive and the flattening out down here. So we're not even at that, because we are still on this very steep rise. We are 3rd in the world now. We may very soon pass up Italy. And it is also possible that we will be surpassing China in the number of confirmed cases. Hopefully not ever in the number of deaths, but in the number of confirmed cases.
Thank you. So we just got a question in, and I want to ask it because I think it might be helpful for viewers. What should people do if they don't have a primary care provider? So we talked about call your doctor, but just community resources that are available for folks.
Okay. Oh, what a wonderful and important question. There are people that do not have a primary care physician. If they do not have a primary care physician, I would suggest that they reach out to either their health department or local hospital. They can certainly call our health department. We have a primary care physician. I will not say this on the air, but the person's name and number, but they can call us for persons that truly do not have a primary care physician. They can call us, and we have somebody local that you can call, and that will see you. You must call ahead. And this beautiful person is also bilingual. So we do have that resource for you. It's possible that everybody does not have the resource, but do look for it and know ahead of time who that might be. Thank you for asking.
Well, thank you, Dr. Tokars. What an informative conversation we've had this afternoon. I'm so grateful that you took the time during this pandemic to come and inform us today about what's going on in our local response. You know, we have such tremendous resources in the Kendall County Health Department that Dr. Tokar leads, but also Tokars leads, but also our other health departments throughout the 14th district. And for many other issues, you know, our office, my office is standing by to help you. So you can give us a call 7 days a week. We're answering the phones and answering questions and responding to emails. You can also visit underwood.house.gov and check out our brand new comprehensive resource guide. And so if you need some phone numbers for your health department, that's in our resource guide, along with a lot of other tips that might be helpful for you viewers who are thinking about public health practices and guidance for finding childcare, support for small businesses, and resources for seniors and more. And then obviously sign up for our email list. We are sending out blasts several times a week with up-to-date information that you can use to keep yourselves and your families safe and healthy. So you can do that at underwood.house.gov as well. Thank you, Dr. Tokars. Thank all of you for your time today, and I'm looking forward to seeing you again soon. Be well, everybody.